Marlon, if I had to ask you, the NHI, it's got stuff to say about devices, and in your capacity, I mean, I think you're involved with the Summit, the medical devices manufacturers, and you've got a lot of experience in that space. Do you think this is going to stifle innovation in medical devices? Do you think it's a good thing overall? Is just the payer going to change? Nothing changes really for you, or are you going to be affected by? So they're introducing a new regulatory body. How do you see that panning out?
Yeah, thanks, Elton. We see it as an opportunity for innovative technologies because what it points to is if I allude to the previous panel in terms of the outcomes-based environment, I think it'll force suppliers to think about how to collaborate in certain areas as opposed to competing. I think the integrated modeling that has been proposed here is an opportunity for us as suppliers to think differently about how we compete in the marketplace. Every supplier can't do everything, and every physician, every nurse can't do everything. Healthcare is a system; it needs a team of people to deliver care. Similarly, in the technology space, if people focus on what they're good at and then partner in other areas where other people are good at something similar to deliver better outcomes, I think we start to get better results, better outcomes. So I want to speak about where I see technology playing a role in what is being proposed. There's been all kinds of developments in the app space. In the public sector, the Mom Connect system that was introduced there has made a radical difference in terms of how mothers are able to interact with the system. Are there other opportunities from an applications perspective and the integration of those applications from a telemedicine perspective? On the training side, can we train people in rural areas from a central location? Can we integrate ambulance services? I know, having been at Philips previously, Philips has been doing integration of EMS for years, so that when the patient's in the ambulance, already the doctors in the surgery are preparing for the patient. So technology can play a radical role in terms of the system that's delivered. But we've heard time and time again about resistance to change. And are people prepared to change the way they do things? From a technology perspective, we're fortunate that if you don't innovate, somebody else will kick your butt. And you need to, so competition is happening at a rapid rate already. So to be competitive in a technology space, you have to be constantly innovating. So it's the nature of the business that we're in. So I see a huge opportunity for technology to impact on the NHI.
Yeah. Who's actually read the NHI document? Hands up. In preparation for the conference. So, what does it say about where you register for your care? So you got this thing in your head, you're going to go. It goes into so much detail on you need to have your ID, they need to check. I couldn't, when there's a Home Affairs database, you should have one if you've got an ID, So for me, there were so many opportunities. I don't know if Jonathan, did you get that sense when you read through this? It's quite archaic, some of the systems that instead of saying, you just rock up with your driver's license or your smart ID card. Why must I have another medical aid card now when I'm
Yeah.
Yeah, so I think technology can speed some of these things. I don't know if you got that sense.
Yeah, there has to be a better way, a smarter way. I mean, one of the things we're trying to do with digitalizing our entire value chain in the blood service is that in the future, and this is the near future, when you arrive as a donor at one of our clinics, there will be facial recognition that will immediately link you to the donor profile that we have. You will have filled in the questionnaire on your smartphone or on your iPad or computer or whatever else. And if necessary, we would have deferred you. That means that if it was too soon since your last visit or you'd been in a malaria area or something like that, we wouldn't waste your time by asking you to come through to the clinic and try to donate. Similar kinds of technology are in fact used in this aircraft where there's a camera on the front, and for the receiving physician or the receiving nurse on the other end, they'll either have a fingerprint or a code SMS to them, and we will correlate that with facial recognition technology to open the compartment to be able to take out the blood and therefore verify that the right patient or the right clinician gets the right blood. So that's how we're solving for that part of it. But I agree, there has to be a better way using biometrics and the technology that's readily available today.
Fanie, your sense of the challenges to, I mean, I think the minister mentioned this, the inequality, our rural-urban split and that kind of thing. Or do these present challenges, or what are the challenges, what are the opportunities in a country like South Africa? And I mean beyond, so a lot of, to implementing these. It's all well and good to say, I've got this pharmacy. You need electricity, you need someone to restock it, you need, how have you found those kind of
I think,
challenges?
Look, I think there's sometimes a misperception of the real challenges when it comes to, I would say, our area of focus, which is obviously dispensing, distribution, and collection of medicine. And I don't think I get the idea, that everybody's got an opinion about it in the private sector, but unless you are there in the rural area and you are in Alex, you realize the challenges. So the challenges is that's why we're going to NHI, is because of all of the challenges. Mm-hmm. So I think regarding the dispensing and distribution of medicine, I think, we would like to say, in the pharmaceutical end, we're the bottom of the food chain, if I can call it that way. So it's quite unique to innovate in that space. But I think if you look at NHI, you must remember that, you can't do patient management, you can't do costing, etc., when you don't know who's standing in front of you and what he and she's using or not using. So, all those disease-specific programs need to align with data. And I think that's the big gap, So, we've been told that every facility that we've gone to, yes, there's a software system, there's an electronic patient record. None of them had it. And I think that's where, we started saying, let's adapt the innovation, let's add products, because, it's not all innovations. It's sometimes just customization of existing things. So sometimes you don't have to innovate. You just need to work with private sector and solve the problem. So, the bottom of the food chain, which is dispensing and distribution and collection, is actually from our end, we would like to play the part to say from bottom up, that's where we would like to meet the partners in the middle. Because it is a tough environment to create that. But, I think, after 3.5 years, we've got Stockmaster file. We can tell you, not yet, but because not my patients, it's government patients, but I can tell you who's using what and etc. So,
can I ask, Clyde, you operate in multiple markets.
Yep.
G is a global company. Is there learnings, is there stuff that you guys see in other markets that you think will help speed up, address some of these challenges that people see with the implementation of NHI or similar systems?
Yeah, definitely.
Because you operate in these.
Yeah, definitely. Shrey spoke a little bit about what they see in Western Africa, Western Europe today, and the partnership that we have. We do a lot of work with that partnership actually in Western Europe. So there are a tremendous amount of learnings that we see in different markets, and I think we've seen what's happened in the US, we've seen what's obviously happened in the UK. But once again, it comes down to stakeholder engagement and stakeholder management. So a lot of that's going to come down to how we're going to roll this out over a period of time and be wise enough to learn from some of the critical elements that are either working or not working as well as what they could and should be. So I think that's important. I think the other thing is within the the NHI, they speak a lot about the healthcare technology assessment, and I think what's really important there is that's widely used to be able to think through the adoption of what technologies and to make sure that they are proven technology. But I think what's important there is we've got to think through that in the South African context. It's really there to be able to think through evidence-based technology, utilization and usage, and then think through the systematic cost of that and the implications of rolling that out. So I'll give you like a simple day-to-day example. There's a very high level burden of cancer and disease, right? So you take women's health, and if you go for a breast screening, ultimately, you've got multiple different things that you can screen for, and you've got multiple different modalities and different techniques that you can use to screen for. And that can go right up to an MRI if you want to be able to screen on breast. So I think, we need to think through, the NHI is not going to have, they're going to be able to think through what are their codes that they're going to be able to fund, and what are they going to come up with an agreement on what they will fund and what they won't fund. So I think it's important for us to think through those assessments, make sure we're making the right decisions for our country, our population, and making sure we're doing the right thing. It's just like in the UK, if you travel abroad and you speak to mothers there, they'll always complain that they couldn't have a C-section, and there's reasons for that. And obviously in the UK, they've standardized on certain parts of that, and that's their code today. Whereas in South Africa, we're totally the opposite. Everybody wants to play golf on a Friday, and they want to have done everything from Monday to Thursday.
On a Wednesday afternoon.
So I think that these are like South African anomalies on how we do things, but I think they're really, really relevant for us to think through. So the more we can have on communicating and spending time in other markets and understanding what works and doesn't work, I think is highly relevant.
Marlon, single payer. I mean, so now surely now all these marketing costs that you guys now have been going to hospitals, I mean, once again, the NHI is quite clear on this point. They will buy the stuff and they will deliver it to the provider. There's one point that did anybody else get that? Sometimes you read this document and you don't know what's real and what's not, So there'll be a procurement authority that will purchase these things. They will be held in stock. They will be delivered to Life Healthcare if you're looking after our patients in that region, a GP practice, gloves, and all of that. Just take me through. Do you see any challenges with that kind of thing?
Speaking in my personal capacity,
Yes.
I wanted to suggest to the minister that typically you need to earn the right to do certain things. So without getting too much into the politics of the country, let's start there. Okay, so show me where you've done this successfully before. All right, and then earn the right to do what you're proposing. So you're not good at this. Maybe hand it over, like I said earlier, hand it over to people who are experts.
Yeah.
There's people who have gone to university to study procurement and supply chain for many years. Let's bring those people into the system and let them manage that for us.
He seemed, I didn't
well,
get the
we'll
sense
engage
they were
him.
not open to that kind of...
we're going to engage on that point.
Yeah.
We're seriously going to engage on that point. So that's the first thing. I mentioned technology earlier. I think where technology can play a role is on this point of managing that better, is in the corporate governance aspect. So if we use technology to automate a lot of these procurement functions, that takes out that element.